Hi, I'm Dr. Alison Grimaldi, and today we'll be talking hips. When the time comes for surgery for advanced hip osteoarthritis, it's not a one-size-fits-all in terms of surgical and prosthetic options. There are choices around conventional total hip replacement or hip resurfacing, cemented or uncemented prostheses, bearing services, and surgical approaches to the hip. My blog on this topic is developed from an interview I recorded with Brisbane Hip Clinic orthopaedic surgeon Dr. Patrick Weinrauch. You can find the key points in the blog, as well as a videocast and podcast in which we explore the options available and the relative indications, advantages and disadvantages, limitations or risks of each procedure. It's important for non-surgical health professionals to be aware of these options, as there are implications for post-operative management and advice provided to our patients. Thanks for joining me, and I'll see you on the next episode of Talking Hips with Dr. Ali.